The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Welcome back to AM Northwest. It's Lung Cancer Awareness Month. And did you know lung cancer is a leading cause of cancer deaths worldwide? But lifestyle changes and routine screenings can increase survival rates. Here to share more, we welcome the Director of Robotic Surgery at Providence Cancer Institute, Ariel Safarzadeh. Good to have you, Doctor. Good to have you with us. First, let's get right into it and talk about lung cancer. And start with the risk factors for lung cancer. What are they?
Yeah, so in the United States in particular, lung cancer is most closely associated with smoking. So 80% of patients who develop lung cancer had a history of smoking or current smokers.
Oh.
Outside of smoking, radon is the most common risk factor for non-smokers. And so radon is this colorless gas that's kind of present in most homes. You know, when you go buy a new house, they test for radon levels.
Right.
And so, yeah, if those levels are above 4, which is the number they use, that's an indication for getting like a radon mitigation system. And so radon, we know, has radioactive abilities and can cause inflammation, irritation of the lungs, and because we breathe it in, and that's where it primarily affects us. It's a gas. And so radon is number 2. And then outside of that, we think pollution too. So indoor pollution, outdoor pollution. We're particularly concerned with these small particulates, so cooking over a stove. For non-smokers, particularly Asian women, we see that there's a higher risk for lung cancer in that group.
What is it that's cooking that's causing this problem?
Well, it's the fumes from gas stoves that come out.
Oh, I see.
So one of the issues is poor ventilation over your stove.
Yeah.
So in your home, I think it's really good to have a nice, good ventilation that ventilates to the outside. It doesn't recirculate the air.
Oh.
And we think that those gases that people are inhaling increase lung irritation. And really anything that irritates the lungs can increase the risk for lung cancer.
Right. Oh my gosh. Okay, and then let's talk about the symptoms of lung cancer.
Yeah, so the most common, for most patients actually, they don't have any symptoms. So 50 to 70% of patients when they're diagnosed with lung cancer never had any symptoms. And
well, then how does anyone find out that they have it? I mean, if
that's
you're
a good
not,
question.
If you're not complaining about shortness of breath or...
Yeah, so most of the time they get a CT scan for another reason. Let's say they got into a car accident, they end up in the emergency room. We get a CT scan, we see a small nodule.
Okay.
For the other group of patients, they were smokers and they underwent lung cancer screening, and they get a CT scan from lung cancer screening. So about half, 50 to 70% of patients who are diagnosed with lung cancer never had any symptoms. We say that was discovered incidentally. But for patients who do get symptoms, the most common symptom is a persistent cough. So you have a cough for a few months, you get an x-ray, they see something that might look like pneumonia, and then that cough doesn't seem to go away. And then
and I'm coughing here, sorry.
You're okay.
I just ate a date, so I was like, okay, there we go.
And then 3 months later, you get another x-ray, and they still see that same pneumonia in that same spot.
Yeah.
That's kind of a common way that we see it. The most specific symptom, though, is coughing up blood. So if you cough up blood, that's a concerning symptom. You definitely want to talk to your doctor right away.
So let's talk about then who should get screened. Someone who's coughing up blood, number 1.
Well, so screening is different. Screening is meant for patients who have no symptoms. And it's really meant for adults who are between the ages of 50 and 80 years old, who are either current smokers or former smokers, and that they quit in the last 15 years. In that group, that's the only group that insurance will cover lung cancer screening for. And that's different than any other type of cancer. So for breast cancer, all females get screened, right? For colon cancer, everybody gets screened at a certain age.
Sure.
Lung cancer is the only screening that's approved for the high-risk group, which is adults between 50 and 80 years old who have a real significant smoking history.
Oh my gosh. And then what are the treatment options? And how successful are they?
Yeah. So we group treatment into one we call local therapy, which is surgery or radiation, and the other is kind of systemic therapy, which is chemo, or right now we have some brand new pills that have come out that can treat lung cancer as well. And surgery is the mainstay of treatment for early stage lung cancer, and it's really changed a lot in the last 20 years. So in the past, imagine we have to take out a portion of someone's lung. and the lung is protected by the rib cage.
Right.
So we have to make a big incision between the ribs. We would have to spread the ribs, get our hands in there in order to take out a portion of the lung. Now we've moved in the era of minimally invasive surgery, where we can put very small holes. And myself, I'm the director of the robotic thoracic surgery program, and I do minimally invasive robotic surgery. So we can put a 3D camera into the chest. I sit at the bedside right next to the patient, and I have a 3D view inside their chest, just like I'm in there.
Wow.
And instead of making a big incision, we just have really small incisions, and we can do the entire surgery that way. And it's really changed the name of the game for surgery. So patients in the past would spend a week in the hospital. Now they're in the hospital for 1 to 2 days, and then we get them home. They're walking the first day after surgery.
Wow.
It's taken a really big problem and really made it easier for patients to recover and get through. And our survival rates are great. So if patients have a stage 1 lung cancer, their survival can be as high as 90% if we catch it early.
Yeah.
The sooner you catch it, the better the outcome.
Yeah. Oh my gosh, doctor, that's fascinating. Thank you so much. We want to tell everyone, if you would like to find out more about lung cancer and the Cancer Institute, all you have to do is give them a call. You see the number on your screen. We'll put all that information for you on our website at k2.com/familymatters. Doctor, thank you so much.
Thank you.
All right.